Prabhakar, good morning to all.
Yes, sir. Good morning.
Can you ensure Dr. Lakshmi is made a co-host, Mrs. Maggie is made a co-host, Dr. Harry is made a co-host.
Yes.
We should start another 2 minutes time. So first speaker is Dr. Harry. Second speaker is Dr. Sally. Then it's Mrs. Maggie. Then what's his name? Ruben comes from Spain, and last will be Nepal. So kindly give them co-host status so that there's no time lost.
Sir.
So as I start the program, you can probably do that.
You please start, sir. I'm already given to Dr. Lakshmi co-host status. Sir. I also given Dr. Hari also. I'm just giving rest of the people.
Yeah.
Hello, Mr. Dr. Canada.
Yeah.
Thank you for me.
Yeah, pleasure.
And for first time, because
don't worry. We'll start now.
Sorry, I have limited time, because.
Dr. Harry, it's a pleasure that you joined us. We don't worry about all that. We want to accommodate and ensure that all of us hear each other. Wonderful.
Thank you.
We'll just start 2 minutes. Yeah. Okay, then we'll move. We'll go ahead with the program. Good morning to everyone participating in the second day of the webinar series on International Webinar on Social Work Profession in Geriatric Care, particularly focused on current roles, challenges, and emerging trends. Distinguished speakers of this morning, Dr. Harry Hikmat, Indonesia, Dr. Sally Hughes from Canada, Miss Maggie Wanzil Chapman from, not Miss, Mrs. from South Africa, Mr. Ruben Macia Martinez from Spain, Mrs. Arti Paudel from Nepal. Beloved partners in our efforts to host this 6-day, 2-hour webinars, Dr. Mangaleshwaran, Dr. Lakshmi from Central University, Kerala, Dr. Panir Sigamni from Central University of Tamil Nadu, Dr. Chanavir from Central University of Karnataka, Dr. Nalini from Pondicherry University, Dr. Chandramouli from University of Mysore, Dr. Leena Ashok from Manipal Academy of Higher Education, and Dr. Raja Samuel, Principal, Madras Law Social Work, my alma mater. Dear delegates from 26 countries with over 1,200 registrations who are here to attend and listen to the interesting talks and presentation by the speakers. The global population are living longer thanks to improved healthcare. Sorry for this interruption. Thanks to the improved healthcare, increased awareness about preventive healthcare, and smaller families. Increased longevity poses new challenges to the global communities in which policymakers, advocacy organizations, families, individuals, and private sector cannot be mute spectators. They are forced to act. If they are quiet, they will not be able to be quiet for long. There are international instruments such as Madrid International Plan of Action on Aging, World Health Organization's Decade of Healthy Aging, United Nations open-ended working groups to talk about the human rights of the older persons, besides policies and legislations to protect the vulnerable older people, international advocacy bodies like the International Federation of Aging, of which I was a global president 2012-14, Global Aging Network based in Washington, D.C., which is involved in lobbying, and International Association of Gerontology and Geriatrics, which is based in various parts of the world. It keeps moving, which talks about the gerontology and aging population, and a very, very strong advocacy body, AARP from US, that has millions of members. International Network for Prevention of Elder Abuse, among others, involved in lobbying for aging issues to ensure that it has its right space in the society. Now, I think it's going to be time for us to pursue with the International Federation of Social Workers, which probably needs to take up this issue of social work and geriatric care. I think they're already talking about it. Probably it has to spread across various countries. Migration of younger generations in pursuit of career opportunities have left behind their parents and migrate to cities and abroad where the parents have to fend themselves. Community care and institutional care are the two major options left for the world people to rely on. Now, in this case, families, neighbors, doctors, nurses, home health care providers, physiotherapists, institutions for home care services, private enterprises, all have come to play their role, but it's probably of not so much of significance as yet in majority of the countries in the world. So social workers in many countries play a very strong role in rendering care to the senior citizens, whether in communities or in old age homes or in senior citizen retirement communities, or be wherever the old people are focused on. The role of social workers yet to be recognized in majority of the countries of the world. In India, very surprisingly, the government of India funds old age homes, what is called senior citizens care homes, in which they make it mandatory for engaging a professional social worker in all those old age homes. I think this is something significant because probably in these old age homes, there will be at least 300 to 400 social workers working in the country. I think this is one area that we would like to focus on, see how we can engage them more closely with the elderly persons. There is a need, from a state to play in ensuring social workers play a very, very important role in addition to other professionals in caring for the elderly. So we are grateful at this point of time that Heritage Foundation, with the support of the universities imparting social work, we could only limit it to few institutions to join hands with us in this particular program. They include Bharatidasan University, Bharatiyar University, Pondicherry University, Mysore University, Central Universities of Karnataka, Kerala, and Tamil Nadu, Manipal Academy of Higher Education, and the Madras School of Social Work. I think I would like to express our deep sense of gratitude to the department heads of social work in all these institutions to come forward to take this program on. We value everyone's time and efforts to be amongst us. We want to ensure that all of you who are attending this program enjoy what you really are going to listen to all the speakers. I want to assure you, we have the best speakers that we have identified from across the countries. And it's not a small number. It's a lot of difficulties in organizing this. For example, Dr. Harry Ikmat, who is coming with the first speaker, he has to attend a meeting with the minister. So, he has to go. I think these are all the challenges that we have. Kindly use the best of our time and your time. And we are honored to host this global seminar. And I want all of you to take away. And what are those takeaways from each institution, each speaker? I think this could be very evident as you listen to it for 2 hours of time. Yesterday, we had excellent speakers. We had so much to learn. I think this will continue for including today, 5 more days. Don't miss an opportunity. We have a very, very small, we have some insignificant requests from every one of you who are participating in this program as participant. I think the gift that we want in return for all this organization from you is a little bit of discipline. And one is kindly remain always muted. We do not want anybody even by mistake, unmute yourself because this would interrupt the speaker's talk. Kindly accept and acknowledge and appreciate in case you find any of the points mentioned by the speakers, you find it worthwhile. You can even mention it in the chat box and also use the reactions column to either clap or to shake hands or to give a bouquet. Just don't do that. Don't miss it. I think it's important that you need to give back to the speakers at least that much of acknowledgement for their efforts. Please use the chat box to make comments about the talk and the subject. We would request you to refrain from writing anything other than the subjects being discussed. We would want to very, very closely gatekeep this. We would be very grateful if you don't do that. And we will, in case those of you are asking for some questions which are not able to answer, we will do that at a later date by writing to you on emails. Two, and we also have a request. A lot of you have been asking for PowerPoint presentations. Please write to us after the 6-day session is over. On a case-to-case basis, we will give it to you. We cannot be sending it to all. Please bear with us. Please do that after 5th of August. We would be very happy to respond to you. Please understand that the first speaker will have a translator to help him present his points. Therefore, it might take a little longer than the usual talk, and be patient to listen to both what he has to say because he's a very, very senior government official who has been kind enough to come forward to talk to us. Please provide him all the support. And the next point, feedback. Feedback form link will be given to you at the end of all the speakers. Kindly don't ask for it in between. We will not be able to do it. And don't use your personal chat box to promote your personal interest because that is not meant for this. This seminar is not meant for that. And finally, I would like all of you to enjoy. And once again, we welcome all the speakers. Now, finally, Dr. Lakshmi, who's the chairperson of today's program. Now, she is a professor in Central University of Kerala, and she has conducted several such programs that we have organized today. And one of those programs that she conducted a year before last, she produced a book on active aging dynamics in the post-modern era. And I think we have such big contributors, significant contributors to join us. Please join us in welcoming them with all of you, welcoming them with your clap and shake hands. Thank you. All the best. Thank you. Look forward to it. Thank you. Dr. Lakshmi.
Thank you, sir. Yes, sir. Thank you very much. Good morning. Welcome you all to the second day of the international webinar on social work profession in geriatric care. Today we have Dr. Harry Hikmat from Indonesia, Ms. Maggie from South Africa, Mr. Ruben Masia Mattings from Spain, Ms. Arati Podal from Nepal, and Dr. Sally Hughes from Canada. Each of the speaker will have 15 minutes for the presentation, and maybe we can have discussion at the end of the session, end of all the speakers. Yeah. So the first speaker is Dr. Harry Hikmat. Dr. Harry is the Director of General for Social Rehabilitation, Ministry of Social Affairs, Indonesia. Let me invite Dr. Harry to speak on the topic long-term care for the geriatrics, family-based home care services. I think Dr. Harry will be having a translator, and because Harry will be speaking in Indonesian local language, so his translator will help us to understand what he speaks. So over to you, Dr. Harry. Welcome you.
Okay. Thank you, Ms. Lakshmi. Before, I would like to say thank you to Dr. Gangadhara from Heritage Foundation, India. I'm honored for being speaker in this international webinar series. And then, ladies and gentlemen, I want to share my presentation. Ladies and gentlemen, I would like to say thank you for the opportunity for me to present in this event. It's such an honor for me. In this opportunity, I will talk about long-term care for geriatrics, especially family-based care and home care services in Indonesia. First of all, Indonesia defines elderly as someone who has reached the age of 60 years and over. Yeah. And then we categorize the elderly into two categories, namely potential elderly and non-potential elderly. This category of non-potential is what mostly get long-term services. The government focus a lot on the non-potential category to become a priority service, but doesn't exclude the potential elderly. Both those categories receive a specific program. Based on data on the screen, it is seen the elderly population in Indonesia is estimated have reached 10% in 2020, and the percentage of the elderly population will continue to increase to 60.5% in 2035. That prediction also shows that the number of elderly women is more than the elderly men. And conversely, as you can see on the screen, the children population reached its peak and now start to decline. And we see there is possibility of demographic dividend. The situation occurs when the working age population continued to grow until 2014. Data on the screen show that elderly population is rising and accelerating so fast. In the 2045, we will get a 20% population increase. Old age dependency ratio in increasing drastically. It is expected to double over the next 20 years from 15.7% in 2020 to 30.3% in 2045. So after we talk about the condition of the population of elderly in Indonesia, then I will convey about the disease and the condition of independency of the elderly in Indonesia. Of course, this is something that will be closely related to what we will discuss. We identify that the most common disease for elderly in Indonesia is hypertension, for example, with 63.5%, and followed by dental problem with 53.5%. I think the treatment of those diseases deeply need care and support from the other, including family member and professional. That is why the Ministry of Social Affairs really concerned about these issues. Next slide. We can see how independent the elderly are and look at their expectation of who they expect to care for. 35.2% the elderly expect that they will be cared for by their spouse and children. And 49.7% elderly expect they will be cared for by others. The data based on the survey from National Planning Agency 2020. That means every elderly who have decreased functional capability acknowledge that need the require long-term care. The elderly want to be cared by their partner and children as a companion. If they need treatment assistance in the future, that's why family, especially spouse and children, need skill and abilities in caring for the elderly. Related to the previous slide, the facts show that 40.64% of the elderly live together with their extended family, while the number of elderly living alone or with other doesn't reach 10%. However, if the elderly have no family, we also provide home care services by professional or volunteer maybe, so that elderly can still receive care. Our respect to the elderly, I've seen from data that 79% of elderly caregivers are family members. They play an important role in daily caring of elderly, especially if the elderly have a chronic disease. We make sure to take regular medicine, assist in routine monitoring of blood pressure, measurement or tension, independently at home, body temperature measurement, sign of disease that are not typical. So they can immediately take them to the emergency response in emergency case. Some examples of non-typical disease are personality change, loneliness, refusal to eat, etc. In addition to routine periodic maintenance, there are several things that home care and caregiver Indonesia must also pay attention to, as well as sensitivity to the sign or symptom of something that might occur. Currently, 10% of our elderly people really needs a daily caregiver. And in order to fulfill this, home care plays an important role in being able to be integrated in place, role of in teaching caregiver and family members in caring for the elderly. During the pandemic of COVID-19, the elderly in Indonesia are encouraged to stay at home. However, care facilities still can be used long as not an emergency, with the some principle of service, namely plenary assessment and comprehensive geriatric system. Of course, we do regard to health protocol for the elderly. Home care play is a very important role in the welfare of the elderly by accommodating the needs for elderly care, such as physical, medical, nutrition, medicine, physico-cognitive, and so on. Therefore, the existence of home care is very much needed to be able to maintain and ensure the welfare and accessibility of the elderly in Indonesia to their needs. During the pandemic period, Indonesia is seriously paying attention to the safety and health insurance for the elderly. In addition to the treatment that is on your screen. Yeah, the elderly are the first group to be given vaccine and get facility to be prioritized for health services. In previous slide, we said that home care services during this pandemic are still possible to carry out. Because we realize that matters relating to needs of the elderly are important things to be able to raise. There are several things about the elderly who need home care services. These are elderly patients who don't have an acute illness, but are under regular treatment from a doctor. And the elderly patient who requires routine physical therapy, occupational therapy, speech therapy, or inserting of a feeding tube or catheter. And also elderly patient who requires great effort to visit health facilities, for example, immobilized patient or homebound. Then who will play the role of home care services for the elderly? Many professions, I think many professions are needed and include training voluntary. The role of one profession with other professions has their respective portion in order to provide services to the elderly. I think social workers have a very important role that lead to the unique opportunities, which include making deep and meaningful connection with elderly and their family. Singing problematic system at both the personal and community level, and the knowledge that their work have a direct positive impact on those in need. Social work plays a very interesting and challenging role. In this case, social work has the responsibility to able to provide physical, psychosocial, and spiritual therapy, advising elderly family how to support aging loved ones, and other things as mentioned in the presentation. In outpatient setting, geriatric social workers are advocates for the older adults, ensuring they receive the mental, emotional, social, and family support they need, while also connecting them to resources in the community. They may provide additional support. In inpatient and residential care setting, they conduct intake assessment to determine patient mental, emotional, and social needs. Also collaborate with team physician, nurse, psychologist, case manager, and other healthcare staff to develop and regularly update patient treatment plan. Besides that, discuss treatment plan option with patient and their family, and manage patient discharge. As I said earlier, the role of social worker is very existing and challenging at the same time. Various things are needed in realizing and optimal and maximum services for social work. There are several things that are challenges in Indonesia, such as the level of skill related to family-based long-term care issue, need for association related to geriatric social worker as a medium for sharing experience and formalizing competency standard. Competency certification, how they expand to other professions, their role in long-term care, and caregiver training to ensure family have competency in providing services and care for the elderly at home. After, we see many things happen to the elderly from care and social work. There are many things to be discussed in the future. Yeah, I hope in the future we can make a cooperation, yeah, with Heritage Foundation. There are many things to be discussed in the future, which are very interesting. Imagining how the growth and development of the issues of the elderly Indonesia will be in the future. It is necessary to have sufficient anticipation to deal with this in the future. 7 things that can be done at this time are increasing the quality and quantity of the social service program for the elderly to protect the elderly for various risks and aging, illness, neglect, loneliness, etc. Provision of certified social nurse or caregiver. Yeah. Sometimes in Indonesia, the name of social caregiver, like as social nurse. I think in the social worker, maybe paraprofessional on social worker, including social nurse from household member, children, grandchildren, sibling, household assistant. Increasing the role of the family in the care of the elderly, improving public services through the elderly posyandu. Indonesian have integrated services for elderly in the community base, in the grassroots level, which provides support for the elderly in accordance with the developmental needs of age. And the other, enhancement of national sustainability campaign across all sectors, okay, increasing the role of the community and private sector in helping the elderly, including job opportunity, especially for the potential elderly, improving the quality of social services of the community from an elderly early age, so that in old age it does not become a burden to the family and society. That's all I can say about long-term care for geriatric family-based home care services. Indonesia uphold respect and ideal for the elderly. We believe that the various efforts we make are in order to create welfare for all elderly. Happy elderly with family. Thank you so much. Thank you, Dr. Ganga Darai.
Thank you, Dr. Henry. It was a very, very detailed presentation with regard to, yeah, the scenario of elderly in Indonesia. And you have outlined the importance of social workers in providing psychosocial and spiritual therapy. So very, very, very interesting to know about that also. Then other than that, you have made very clear regarding the challenges which are faced by the professional social workers. I think the very first point which you mentioned is about improving the skills, which is very, very essential in order to be an effective multidisciplinary team member, so that social workers get recognition. So thank you very much for this beautiful presentation.
Ms. Lakshmi, I'm sorry.
Anything else?
Yeah, I want to check Dr. Lakshmi, 1 or 2 questions for him in case there is anything on chat, or we would like to move on. Okay. Because he might leave.
Yeah, as
I'm not sure. Yeah.
Yes.
Sorry for the interruption.
Yes, as he is leaving now, yeah.
1 or 2 questions if they're there.
Dr. Harry, do you have? Yes. I'm not finding any question as such.
Nice to meet you all. I apologize. because I have other agenda at the same time, I cannot fully participate in this event, but I still monitor the question and answer. Yeah.
One question I would like to ask, Dr. Henry, only one question, Dr. Harry, I would like to ask you. How many professional social work institutions are there in Indonesia? It's a large number of colleges and schools that offer course on social work?
Still limited number.
Okay.
Yeah, about 15,000 social worker, but not all certified and have licensing for social worker. And also we can difficult to expand the competency specialist in geriatric social worker.
Okay.
Because we don't have specialist university. Yeah, already have social work with geriatric services.
Wonderful. Thank you. Thank you, Doctor.
Thank you, Mr. Khan.
Thanks for coming despite your hectic time. We really appreciate, and we will definitely revert to you for our future programs. Thank you so much.
Thank you. Thank you.
Dr. Lakshmi, I'm sorry, I interrupted.
Yeah. Thank you, sir. Thank you, Dr. Harry.
Yes, okay. Now, yeah.
Yes. The second speaker is Ms. Maggie Van Zyl, a social worker by profession, connector, collaborator, and inspired.
Sorry for the interruption.
Yes.
Can you just check whether Dr. Sally has come, because our time is now 11 o'clock in the night in Vancouver. In case she is there, let her come.
Okay.
Shali is there.
I am here, Dr. Ganga.
Yeah, so I think if she comes, it'll be nice.
Okay.
So she's there. I'm sorry for the interruption, Dr. Lakshmi.
Yeah, thank you. Thank you, Sally. Yes. So may I now welcome Ms. Maggie, sorry, is it? Yeah, now it will be Sally. Yeah.
Sally Hughes, Dr. Sally Hughes.
Yes.
Yeah.
And
Yeah. Happy to have Sally Hughes, who has done her BA, BSW, MSW, and PhD from University of Victoria on the topic Social Dimensions of Health from 2003 to 2005. She did her PhD courses in health studies and gerontology in 2002. You are welcome to speak on the topic social work and elder health care in rural developing countries. Welcome, Ms. Sally.
Thank you, Dr. Lakshmi. Thank you. And good morning to all of you from Vancouver, Canada, where it is still very late on a Wednesday evening, 11 o'clock on a Wednesday evening. Can you hear me? I'm hoping you can hear me, please.
we are all able to hear you. Don't worry. Go ahead.
Thank you. It's an honor and a pleasure to be joining you this webinar experience. Yes, I'm a gerontologist as well as a professor in social work and a social worker with my roots in primary healthcare. And I hold the PhD in social dimensions of health. And I think we all know only too well that over past years, gerontological social work has often been undermined as a specialist area of social work practice. Throughout its history, actually, gerontological social work has been challenged to define its relevance and authenticity, as well as fight against ageist policies and cultural assumptions. So bear with me a moment while I find my slide here, slide presentation. Wait a moment.
Yes, it's coming.
It's coming. I am screen sharing. Is it now? Can you see it now? No.
We can see very well. We can see very well.
Can you see the slide presentation?
Yes, please.
Yes,
kindly move on to slideshow. Yeah, thanks.
All right. Just a moment, slideshow. Okay. So These current trying times brought on by the coronavirus pandemic, I think, have added yet another layer to our attempts to minimize negative outcomes and improve health and quality of life for older people on a global level. And so I think that the focus of this webinar series, Challenges in Social Work Profession in Geriatric Care, Current Roles and Emerging Trends, I think it's very, very, very timely. As the aging population has grown, so has the role of social workers in elder care. The risk of more health-related issues and conditions occurring has increased, as has the need for geriatricians and other healthcare practitioners. And this is especially relevant in the recent work I've been doing in developing countries, and that's the focus of my presentation today. And I'm trying to advance the slide there. Okay. So I think that we have become more and more cognizant of increasing efforts to meet the needs of this burgeoning elder population in both developing countries and developed countries. There is a word that I first heard in Kenya. It's Ubuntu. And I think that it means I see you and you see me. It's about knowing and to be known, which is one of the most human needs throughout the lifespan, to belong, to connect. And in later life, the opportunities for older people to be known and to belong, they often shrink along with the serial losses that are experienced by many aging people in many cultures. As we know, the reality is that the older population has often been marginalized and plagued by ageism and age stereotyping. Many elders are faced with extreme poverty and other problems such as limited access to resources, to healthcare, and often very oppressive policies. There's been a growing awareness globally in the past decade about the gender inequities in care delivery. And I believe this is particularly true in the case of older women, who are particularly marginalized and often ignored in many cultures. And the serial losses that later life often brings are accompanied by an increase in deteriorating mental health, particularly depression. So older women particularly are oppressed by cultural values, patriarchal practices in many countries. Policies such as land ownership really affect older women, and they serve to further the vulnerability of the aging population. So add to that the stresses of isolation and loneliness that is exacerbated by the COVID pandemic. And there is a need for provision, I believe, of increased basic counseling services and resources. However, in many rural and poor areas, there is a lack of mental health professionals and a lack of awareness and a lack of education in issues of elder mental health, particularly. Now, my own career has been in social work in healthcare settings, primarily with older people. And after practicing and teaching for 30 years, I've spent the last 10 years volunteering in developing countries, Africa, Southeast Asia, working with governments and healthcare providers. So I'd like to share with you some of that now. This, for example, is the house of an older woman that I was working with in a very remote area of Ethiopia, in an area of Benishangul Gumuz on the border of Sudan. And that is one example of the living conditions of older people who live on their own in rural areas such as this. So nurses and physicians at the hospital that I was working faced major frustrations and barriers due to lack of resources to do their job. So the material resources that they had were painfully inadequate, and virtually no technology to diagnose in their diagnostic efforts. And so I think there was one X-ray machine, and that was the only equipment, and it was broken for the entire year that I was there. So I find that older patients, particularly in those rural areas, were the ones that were most marginalized and most ignored. Even basic equipment, such as beds, was scarce, and increasingly isolated older patients with advanced and complex health needs, together with few professionals to address the huge caseloads, created very, very stressful situations. Now, mental health issues, particularly aimed at elder people, they're rarely addressed. In some more resource-rich areas, of course, there may be one mental health nurse or one psychiatric nurse, but never a psychiatrist or never a social worker, who is probably on call 24 hours of every day and no possibility to admit and treat patients. And this fellow, this nurse, and his couch, which is where his patients lay down, and he provided some counseling on his couch here. Now, certainly, as I said before, there's a strong need to achieve improved key policy goals. Now, having said that, and recognizing the need for advocacy, I also believe that there's huge potential to improve elder care through some very simple, very basic social work skills that can be taught to anybody who's caring for older people working in desperately challenging environments, wherever they may be. And I think this can make a very real difference. I've seen it make a very real difference, particularly when demands seem to outweigh the availability of services and resources. So I want to share with you now just a little bit about some of the basic social work skills that I was able to practice and to equip different multi-level healthcare providers with basic social work skills, such as active listening. And you'll see that the language here is pure social work. The quality care described as holistic, non-judgmental, empathetic, respectful, and empowering. And so I'm going to share with you one such project in Ethiopia that I initiated there. And it's interesting because particularly, let me just go back for a moment. No, can't go back for a moment. That's all right. Particularly later in my work in Ethiopia, I fulfill this educative role in helping healthcare professionals in rural areas to develop their skills in compassionate caring for older people. Basic focus on elementary counseling skills. So compassionate care. I was volunteering with an organization called CUSO, Canadian University Services Overseas, and Global Affairs Canada. And I know that there are multiple opportunities in many, many countries for partnering with different NGOs and building capacity in the caregivers there through volunteering and teaching in those areas. So I was privileged to work with the World Health Organization and the Ethiopian Ministry of Health. Now, as you can see by this slide, just a moment. As you can see, there's a number of health-related challenges beyond the control of healthcare providers. Groundwork with the ministry had already been successful in policy setting, and this idea of compassionate and respectful care was actually included as one of the agenda items in the health sector transformation plan. And this was as a result of some advocacy prior work by the NGO and that I was working with. So you can see how important the advocacy is to change policy. And that opened up this opportunity to help provide some basic social work skills and knowledge. So my role was to train multidisciplinary healthcare personnel. And of course, my plan was to reach older people, to highlight elder care. Now, after the training, it was incredibly important to honor those who had finished the training in compassionate care and honor them by formally recognizing the graduates with certificates, because education and recognition is so important in this work, I believe. So it's a movement. It requires champions who identify with their profession and take pride in helping people. And it requires, in some ways, a cultural change and a change in attitude and manners and approach to healthcare delivery. Now, the work had only just begun. Hopefully, it will be revitalized after working through the COVID pandemic. But also, I believe it's a model that can be adapted and adopted in various ways in various different countries. Excuse me. Oops. Can't seem to get this last slide going. There we go. So in summary, it seems to me that social work services are faced with just a wide range of demands to meet the needs of this growing global elder population. But I believe that potential exists to reinvigorate gerontological social work with elders who have complex needs and multi-dimensional vulnerabilities. And I want to end this now. Stop share and get me back again. And what I want to do is finish by saying that I think we've seen in the past how education in gerontology can foster opportunities for positive developments in policy making, which is incredibly important. And I believe in this time of crisis, perhaps there's renewed opportunity to increase our arguments about how to better support this growing population. But today, this presentation has been mostly about grassroots, basic social work knowledge and skills. My students have often told me in the past, there's too much to do. There are so many needs, so many people. How can I possibly feel I'm making a difference? And basically what I said to them was what you need to think about is making a difference to the one in front of you, to that one in front of you. And I believe that gerontological social work has much to offer in our roles as researchers, educationists, practitioners, and advocates during this crisis. But our foundational principles, our grassroots counseling skills have enormous values and will serve us well. And so thank you for listening. It's been a privilege to have been chosen to join you today. Thank you.
Thank you. Thank you, Dr. Sally. It was a very, very effective presentation on the topic, issues of elderly in developing countries, especially health issues among the elderly, mainly focusing on the mental health aspect. And you have also stressed on the importance of compassionate care, which is very, very essential. Of course, this is very much required even for the social workers. You have also highlighted the importance and relevance of gerontological social workers. Maybe we need to get a lot of training with regard to this as far as geriatric social work is concerned. So thank you very much for the presentation. Would you like to take some questions now? Let me check in the chat box. Yeah. Yeah, I'm not finding any questions as such. people are appreciating your presentation.
Thank you.
Yeah.
Thank you, everyone, for letting me join you.
Yeah. Thank you so much.
Thank you.
Thank you, Sally. This is Ganga. All the very best to you. Thank you.
Thank you so much.
Very nice. Thank you.
Yeah. Right now we have Mr. Ruben also, maybe like as per the schedule, shall we proceed with Miss Maggie Van? Hope she is there.
Yeah, I think so. Yeah, Ruben, we have missed him, so he can come next. I think he can listen to others. And it's also a little early for him in the morning. Yeah, thank you. Thanks.
Okay, so may I now welcome Miss Maggie Van Zyl from South Africa, a social worker by profession, a connector, collaborator, and inspired facilitator and influencer. Margie is has a lifetime career in the field of aging, with a particular interest in long-term care, leadership training, capacity building, and partnership development. She is passionate about networking, helping organizations to share stories and collaboration for the greater good. She runs her own consultancy, Take the Lead Living Well, Aging Well, and is focusing on leadership development in the care sector, particularly in the area of healthy aging. Ms. Maggie will be speaking on the topic Advancing Healthy Aging Through Networking and Collaboration. Welcome you, Ms. Maggie, and it's over to you.
Thank you. I'm just going to share my screen.
Yes.
There we are. Thank you for the privilege of sharing with you today. In my lifetime career as a social worker in the aging sector, the key role for me has always been networking, being a connector and a collaborator. So what I share today is a bit of a personal journey, focusing on my role in advancing healthy aging.
I think Margie, are you having by any chance two connections with you? There seems to be a lot of noise.
One you need to be muted if there are two connections.
You can use them, but you have to mute. That's all.
All right, is that better?
Is the guiding concept.
Is that better? Can I continue?
Yeah, please. It's wonderful. Thank you.
Okay. So as I said, what I want to share with you today is a bit of a personal journey, and it focuses on my role in advancing healthy aging in South Africa through networking and brokering resources for the greater good. In years gone by in South Africa, we were stuck in a very institutional medical model of care. It was always my goal to help in whatever way possible to move towards an aspirational model, rather, and to break away from this medical model of care. As I worked around the country in aged care, I saw residents not moving much. Residents were receiving comfort care. Residents were becoming increasingly dependent, and residents were not being offered opportunities for improved health outcomes, regardless of their age or their health conditions. Though care staff were well-meaning, some of our settings were at risk of unintentionally creating ill-being rather than well-being. 4 years ago, I started my company, Take the Lead, Living Well, Aging Well, to try and make a difference by encouraging a different mindset. We needed to make healthy normal. We needed to focus on healthy aging amongst those who are care staff working with elders. With a new mindset, we would get new results. So we needed to move from elders being passive to knowing that elders are active. We needed to move from the thought that inactivity reduces risk to the fact that inactivity increases risk. We needed to move from thinking decline is inevitable to knowing that decline is preventable. We needed to stop focusing on weakness and focus on maintaining strength. We needed to move from care promoting to health promoting, from managing ill-being to promoting well-being. So we needed to change the medical dependency model into a quality of life, aspirational model. The World Health Organization's Decade of Healthy Aging, which was launched last year, has given impetus to this. I also wanted to build on what I had gained from my connecting and networking at many global conferences I had attended all over the world, at which I told stories of aged care in South Africa. Storytelling has always been my tool of choice in building connective networks. I am passionate about telling stories of organizations and connecting them with others. Brené Brown says that stories are data with soul. So I've always tried to connect with the souls of organizations that I've worked with in order to better tell their stories. One connection that I'm going to highlight today takes us back to the IFA conference in Hyderabad in 2014. There I met Joe Boylan, the Chief Operations Officer of Southern Cross Care in Adelaide, Australia. On meeting, we clicked straight away, and we shared our passion of healthy aging, and we shared many stories together. After that, it was my dream to see a gym, or at least some gym equipment, in every care centre in South Africa. I had never seen a gym in a care centre in South Africa before. In many of our retirement villages, there are gyms for the residents who live independently in their cottages, but the care staff never take residents to the gym. Joe and I went back to our respective countries. More excited had I never been to come back determined to focus on healthy aging and to keep our elders moving. I then got an email from Joe saying her board were keen to donate a gym. They wanted to link up and partner with a Catholic organization in South Africa, as Southern Cross Care is a Catholic organization. And so I shared a story of St. Anthony's, a haven of care in deep rural KwaZulu-Natal, led by Sister Lucia. Then at the IASA conference in Lyon, France, the following year, 2015, I met Stephen Cornelison, the CEO of Mercy Health in Australia. After hearing stories from Joe Boylan and me, he too wanted to donate a gym to a needy home. Stephen of Mercy Health and Joe of Southern Cross Care worked together to support a healthy aging project in South Africa. The groundwork had started. For me, it's all about building authentic relationships. This conversation started at the IFA in Hyderabad in India in 2014. And now we see the fruits, and it's 2021. So Mercy Health partnered with Silver Crane Old Age Home in Wellington in the Western Cape. The outcome of these two connections was 2 fully fledged gyms donated to under-resourced care homes. First of all, St. Anthony's Old Age Home in Amakazi in KwaZulu-Natal. And then Silver Crane Old Age Home in Wellington in the Western Cape. I continued close connection with Joe Boylan of Southern Cross Care, and this led to sharing of training material. And so Take the Lead partnered Southern Cross Care and Active Aging Australia in rolling out healthy aging training. It was developed in Australia and adapted for here around South Africa. And it included an exercise program of 25 exercises for care staff to incorporate into their care plans for their elders. To date, over 1,200 care staff have received this training. It's training in small groups. Some online training is also being done, because of the COVID lockdown. It's even more important in lockdown for a physical activity program to be incorporated into a care plan for elders who are being confined to their rooms. You can see sometimes we do the training outdoors. It is wonderful because mindsets are being changed. And there is a real enthusiasm that is evident to focus on re-ablement and restorative care. Believing that a decline in health due to inactivity can be reversed, we are focusing on closing the fitness gap and getting elders to walk until they die and not dwindle till they die. Positive outcomes are being celebrated. You can see this graph is courtesy of Alex Kalashe from when he was working at the World Health Organization. Shows the functional capacity on the left and age on the bottom axis with the disability threshold. And if we treat frailty with exercise, we can close that fitness gap. We have seen residents getting out of wheelchairs and walking again. We have seen residents moving from a wheelchair to a walking aid and then to no aid. It is very exciting to see restorative work showing positive outcomes. Our care staff are taking on new roles and they are embracing these with enthusiasm. They are expanding their role to become facilitators, encouragers, motivators, and health and wellness promoters, working with each person to optimize their intrinsic capacity, enabling them to do more of what gives them meaning, purpose, and well-being. Global connections are all about visionaries and champions. For global connections to succeed, each country needs a visionary, someone to enthuse other organizations, someone who is passionate and appreciative of the value of such connections. Each organization needs a champion, someone who will keep the relationship alive, ensure ongoing commitment and enthusiasm from both sides, put into the relationship and also take out of it. Ensure ongoing staff and management training to sustain learning and best practice, and to continue the journey beyond first contacts and exchanges. Partnerships take time and passion. Connections that last and that are going to be sustainable are connections of the heart. This story of advancing healthy aging in South Africa is still unfolding, but it is one of sharing ideas and wisdom. It is one of complete chance, of seizing an opportunity, of real goodwill, of deep connections made out of authentic relationships. It underscores the power of storytelling and also changed perceptions. Think about the connections that you need to make in order to leverage the networks that you are involved in. Being a connector helps facilitate strategic partnerships between organizations and helps create valuable opportunities for sharing passion, purpose, resources, and expertise. As the quote says, our deeds are like a stone cast into the pool of time. Though they themselves disappear, their ripples extend to eternity. The power is not so much in the stone, but it's in the ripples. And so to close, I want to challenge you and ask you, to where do your ripples extend? Thank you for the opportunity to share a story with you today.
Yeah, thank you, Ms. Maggie. According to WHO, healthy aging is emphasizes the need for action across multiple sectors and enabling older people to remain as a resource to their families, communities, and economies. So in order to attain this, definitely elderly need to have access to healthy diet, nutritious food, exercise, psychological support, social support. So it is very much evident from your presentation that you are doing a lot of activities in order to promote healthy aging in South Africa. Thank you very much. We are very much honored to have you here in this platform, because you are a worker who is working along with the elderly, and we have to take not many things from you. Thank you very much for your presentation and your presence here. Yeah, there is one question from our audience to you. That is, how to create a new mindset in the near future?
That's a difficult one, and I think it takes time. But we need to lead by example. We need to challenge people. And if people get actively involved in running a healthy aging program with the elders with whom they are working, we will see mindsets change, because mindsets change when you see positive outcomes. And so it's not a quick fix, but mindsets do change. We see positive outcomes. And when care staff see residents getting out of a wheelchair, practicing on the parallel bars and walking again, that is magic, and that changes your mindset.
Once again, on behalf of the Heritage Foundation of India and all the collaborators, thank you very much for being with us. Thank you.
Only one word I must tell. Margie is known to me for many decades, more than 2 decades.
Yeah.
We have met in several places, including when she came to India. When I went to I don't miss, when I go to Africa, I don't miss seeing her. I always see her. We have shared an excellent relationship over a period of time. And I think she brought in a new perspective of, as far as the social work subject is concerned, on active aging, how this particular skill social workers can use when they work in the communities particularly, and also in institutions. I think it's a beautiful model where she's talking about frailty being prevented. I think it's just, getting from a, negative mode to positive mode. I can do it approach. Very nice. Thank you so much. Maggie, I thought I must acknowledge that we have known each other for a long time, and that we continue to, share our experience with others. Thank you so much.
Thank you, Ganga.
We'll move on to the next speaker. We are delighted to have Mr. Ruben Martins from Spain. Ruben is the second vice president of Spanish Work Council, having graduated in social work from Valencia University. He is associated as a social worker, Valencia City Council, Social Service Center, then Inclusion Program, Inclusion Income Program, and of current City Council and Social Service Center. And also Excelente Dependencia Program. Sorry, I couldn't spell it properly. Maybe Mr. Ruben can explain it later when he starts the session. Welcome, Mr. Ruben.
Thank you so much.
Can you hear me?
Sure. Yes, I do. Thank you so much, Lakshmi, because the introduction. Yeah. Thank you to all to you to be here in good morning or good afternoon. Here it's 8:30 in the morning. First of all, I have to say that I'm very happy to can be here and had the opportunity to share my experience. That remembers me when I was working in India 8 or 9 years ago in the city of Pune with SNGT Women University, also with Waste Speakers Association. So what I would like to do on those minutes is explain the model of care or the system care in Spain. The system care in Spain is called dependencia system. That's the word that that Lakshmi talk about. No, dependency is like we care about the people who depends of another people to develop their regular daily activities. Okay, so let me share the screen. Yes. It works, right? Yeah, yeah.
Yeah.
Okay,
Yes.
so I think that to understand a model of care in a specific country or in a specific community, we should understand the context and the possibilities, and also the reality and the needs of the people. So this is like the philosophy of the model, right? So we should know that Spain is a semi-decentralized political system. So there is a central government that is in the center of the country, but then there are 17 communities that have the competence in social services. So um, sometimes the decisions are not agreed, or sometimes the resources are different, or the protection is different, for example, from one community to another one. So the first dependence law that Spain have, it's approved on 2006. 2006. So this law is approved by the left wing, and the next year the government changed to the right wing. So this system was not implemented. This system was not funded with money. So the system was like kind of blocked during until 2017. Then the government changed again to the left wing, and finally this system, this national system, was implemented. Is 11 years blocked, system protection blocked. We should consider that until this moment, in Spain doesn't exist any kind of care system. So nothing, zero. And from 2017, it was like an explosion, because we passed from don't have nothing to have a very huge system that provides care to the people who needs. This system, it's a universal system. So this system protects everyone, old people, young people, mental issues people. Also, doesn't matter the income of the family to be protected about this system. So we can say that this system is a kind of universal system. Yeah. So that was I remember that like a very important issue, because from here a lot of social workers start to be contracted, and I will explain why. Because on this system of care, social workers are in the middle. So the social work profession is professional of reference in care system in Spain. Okay, so that law makes very huge changes in the conception of care in the Spanish society. Why? Because before the law, we can say that Spain was a familiarist country. I mean, in terms of care. So who should take care of grandmothers or someone in the family? So socially, the responsibility was from the family. So the family should take care of the clients or the patients. We here in Spain, we call it users. Yeah. So, and most of them who take care of that people, that users. So it used to be young people, single people, and women. I want to remark that because I think it's so important, and it's a gender question. It's feminized work. I mean the care, and I think this is the same around the world, and I think it's very important information to know and to be aware of. Yeah. So before the law, the caregiving was young people, single, and women overall. And if your family cannot take care of you, so the other options was the private systems that they were very expensive and not so much people can get in. Or the other option was the charity. Yeah, charity. I will explain later something about charity. But anyway, in the private system or in the charity, the caregiving were also young and single women. Before the law, the care was related to work, sometimes paid, for sure non-professional without professional recognition. Yeah, and yeah, we also should. This is like a parenthesis. We also should understand that in developed country, European country, sometimes we put charity versus welfare state. What are the difference? Charity with welfare state, just like not deeply. We are not going inside of this topic, but welfare state give to the society warranties, security, equality, and rights that is not provided by the charity system. So for sure, charity should to be there. It's doing a very good work, but some countries are investing in the welfare state because that offer a protection to everyone, or a fair system, or just a recognition of rights, right? Okay, so why social workers are in the middle of this system? Okay, from 2017, the users can apply to be inside the care system, the dependencia system, no? And what should do the social worker? The social worker should go to the patient or the user or the client home and should make a report and evaluation with the aim to measure how dependent or independent is that person. So it's not the same live in a city or live in a rural area or live with social support or with any kind of social support. It's different if you can work or you can walk, or so each case is different. So the social worker should go to the home or to the residence, to the people, and should fulfill this kind of sheet to determine a degree. The system is based on degrees of dependence. There is a grade 1, grade 2, and grade 3. So with this determination of the degree, the people is going to have access to some resources that are provided by the system. So for free, people doesn't have to pay nothing, €0. Doesn't matter the family income. Okay, it's a very huge system. So, for example, if a person have a degree, third degree, so she or he have access to every resource. Also in grade 2, but if the person have grade 1, he or she just have access to some resources. What's about the resources of the care system? So teleassistance, this is a kind of phone that is installed on at the house, and if there is some problem, people just can press the button. It's a red big button, so press the button and the phone directly contacts with the emergency system. The system try to keep as much as possible time users at home. But to do that, people need a minimum of dependence and abilities. Other source is autonomic promotion. This is kind of logopedia sessions or rehabilitations, physical sessions, etc., etc. There is also domestic help. This is so much demanded source. This is just few hours per week. Users receive someone to help them at home, so maybe to clean up home or cook something or go to the doctor or go to the pharmacy, go to the supermarket, etc. There's also food at home. So every day you will get at home lunch and dinner. I want to remark the non-professional caring, because I think this is like so much demanded resource, and it's so much important. This is directly money or yes, it's economic protection to the family in order to pay someone to take care of the user. Sometimes someone of the family have the time and have the voluntary to take care of a user, And in those cases, they can order this kind of resort, and she or he will receive quantity an amount of money to do that work. So we also have a morning center. It's like a residence, but just during the day, and a residence that is all the day. So we are going on non-professional caring. So what have changed from before the law and after the law with non-professional caring resource? So so before the law, Spanish society was a familiarist society, but after law, Spain became in institutionalist society. So people let the care to the institution, not to the family. Okay. Nowadays, caring is better considered. The attention is more professional, and people have been rich. The quality of care have increased, and nowadays there are like degrees or some courses to caregivers, yeah, in order to get the professionalization of their works. Nowadays, also patients and professionals of care are like in better conditions than before. What happened? That didn't change yet. Care is still feminized work, and it's better paid than before, but it's not yet very well paid. Okay, let's about the residence resource. So we should consider that population in Spain is a bit old. We have a lot of already people, and this is 21. So we can appreciate the change that every day the old people is going to be more and more. Coronavirus doesn't change that. One thing to add to that context is the life expectancy. Life expectancy is growing up, and growing up. This decrease is because the coronavirus last year. But anyway, Spain have almost the highest life expectancy dates in Europe. Okay, in 2010, those was the beds in residence that exist in Spain, and 9 years after, with the implementation of that system, I consider that the beds are not so much. So many organizations consider that 70,000 beds in the system of dependence are left. What else? I should say that residents and e-COVID. For example, an example of that system. That system requires a lot of money and also a lot of professionals. So, for example, in a small village, this system or the process works very, very fast. But in the biggest cities, people is writing about the report and about the evaluation around 2 years to be evaluated. that means that people should wait 2 years to get inside the resource. Yeah, this is so bad. So what's about residence and e-COVID? That time was horrible. So residence is a kind of medicalized place. Every residence here have doctor, nurses, social workers, but in a COVID time, residents were closer to family and closer to get visits. People that was living inside residence is kind of weak people, old people, and the virus was horrible when the virus came inside the residence. Lot of people was die because coronavirus in residence, and I should say that nowadays in Spain there is an investigation open in order to clarify what happened inside the residence during COVID, and if the authorities procedure was fine or they made a mistake. So that's whole. I think to work in the dependent system and as a social worker, I mean, and to work in a residence system, it's mandatory to be member of the association. So you should have regulation and you should have a degree as a social worker to work. That's all. So if I extend a bit, I'm open to receive how many questions you need. Thank you so much.
Thank you, Mr. Ruben. I think what I have understood from your presentation is that social workers are part of care system in Spain. They have to report and evaluate the condition of elderly, which determines the nature of assistance to be given to the elderly. So that's what I felt. I just would like to ask you, Mr. Ruben, apart from reporting and evaluating the situation, what are the other roles which social workers are playing in as part of care system in Spain?
So to me, social workers have the best role in social care because social workers have the responsibility to connect the user with the administration, with the system, that sometimes is very complicated. Also have the responsibility to make the relation with the user and the community, and with the user with the family. And the best role is like accompany the user in the last time of life, and accompany the users in this time of isolation, maybe, or mental disease, this time in life that sometimes is hard, and social workers are there to try to pass these times as better as possible. I think it's very nice role to be there with the people, like in contact with the people.
Thank you for the clarification. There is one question for you in the chat box, that is, what expertise is expected from geriatric social workers, particularly in Spain?
So, excuse me, what are the
expertise-
expectations? Yeah.
What expertise is, yes, required from gerontological social workers?
Yeah, the degree in social work.
Yeah.
Now, what expertise is expected from geriatric social
Yes.
services?
Yeah.
Yeah, okay. Talking about challenges. So I think
No,
no,
not about challenges. Maybe the skills, the knowledge, the expertise which is expected.
Mm-hmm. So the degree in social work, with the degree in social work, you can access to geriatric social work position. Just that.
Okay, thank you, Mr. Ruben. On behalf of Heritage Foundation, Hyderabad, India, and all the host universities for your effective participation. You have taken a lot of pain to make this presentation because it's very early morning for you in Spain. So thank you very much.
Yes,
Yeah.
sorry, I'm going to Ruben. Ruben, thanks for coming in despite all your holidays in Europe. I think all of you are traveling everywhere. Understanding, despite all that, we talk about COVID-19, I think there are a lot of travel going within Europe, and it's good that you are all able to take a stand and then move on. Very happy to know that a lot of people have written to me that they would have loved to participate in this conference, but for a lot of holidaying. So I think some people have agreed to come. So thanks a lot for coming. Probably we need to be in touch with each other a little later about, very specifically you mentioned the social worker's role. And when you say that you were in SNDT college in Pune, I think it's all the more a lot to share between your country and our country in respect of social work, of which you are just not a social worker, or also associated as a vice president of the association, which perhaps could be useful to us in the long run to exchange our notes on what we can do it in India, what we can take from you in India. Thanks a lot once again for coming despite your holidays.
For sure, I will happy to recite that.
Thank you.
Well.
Let's move on to the next presenter. I hope Ms. Sarathi Podal from Nepal is here.
She's here. She's there. Yeah,
Okay,
she will come.
okay.
The only thing is we are not seeing her face.
Yeah, that's what.
Arati, where are you? Arati? Yeah, I'm sure she's written to me.
Yeah.
She's written to me. She's around. Yeah, she's there. 1 minute. But Prabhakar, you have to give her a co-host status, and she's Arati is there. Can you just see her? Prabhakar.
I already given, sir.
Huh?
Already given co-host status to her.
Okay, fair enough. I think she's saying hello. I think she's muted. She's muted.
Okay.
Hello.
Yeah.
Namaste.
Namaste. Carry on.
Okay. So shall I start now?
Just a brief introduction about you.
Yes, sure.
Yeah. So Ms. Sarathi Podal from Nepal is a postgraduate in anthropology. She founded SAR Nepal. Very interesting, and is currently its president. She is closely involved in rendering care services to the elderly, based out of Kathmandu, Nepal. She'll be going to speak on range of care services in Nepal, what social workers do, which is very important for us. Welcome you, Ms. Arati, for this international webinar, and it's over to you.
Thank you so much. Namaste. A very warm good afternoon to you all from Nepal. It's very, I'm very glad to be here in this international webinar, and it's very nice to hear from, from our friends all around the world, the practices the practices in aged care services. So it's been a very good learning platform for me as well. So let me share my screen. Okay. Basically, in the beginning of my few slides, I will be talking about the organization I represent briefly. So, SAR Nepal is a not-for-profit organization registered with Government of Nepal and affiliated with Social Welfare Council of Nepal. It envisions a just society for elderly people in Nepal. So, our mission is to uplift, empower, and improve the quality of life of elderly. So, SAR Nepal conducts various programs. So first program initially we started was Nepal's first daycare and lifelong learning center. So this is a platform for senior citizens to interact socially and also to contribute, also a platform as a platform for senior citizens to be able to contribute to the community and also pursue their socio-educational interests. So there are few pictures of our, daycare and lifelong learning center. There are senior citizens who are pursuing their educational interests. Also, we have some experience sharing session as well, some entertainment sessions for senior citizens as well. So beside this, our another program is awareness raising program. So this is the main focus of SAR Nepal because the issue of the geriatric care and the issue of senior citizens are is very unknown to general public in Nepal. So we more focus on awareness raising programs like we in picture we can see signature campaigns and we can also see the radio television programs. So and another program is intergenerational program. SAR Nepal focuses on connecting, generations together. So one of the example is adopt a grandparent on your birthday. So this is a program for youths, especially. So motivating them and encouraging them to listen to their seniors around. And so this is a program just for awareness. And another is intergenerational interaction program on schools and colleges. So we conduct intergenerational program for school students, and so that they listen to the stories of senior citizens. They get to know the issues of senior citizens from the very childhood stage. And another program we want miss is rescue and rehabilitation, especially for street senior citizens. So it's mainly focused in Kathmandu because many of the senior citizens, elderly, are can be seen in the street, and we are trying our best for to rescue them from streets and rehabilitate them in old age homes. So now coming back to the today's topic that I will be presenting, and mostly for a background, I want to share the social work profession in Nepal. So as an academic discipline, a Bachelor in Social Work course was started in 1996 at St. Xavier's College in Kathmandu. It's just been more than 2 decades that the professional social work course has entered in Nepal, and I'm happy and glad as well that I was one of the I was a student in the first decade during this in the history. So. Though it's been more than 2 decades, but there is increasing interest in the course, but still there is a big gap in recognition of professional social workers. We can see very few of professional social workers working in, geriatric care, because it's like, the scope is limited to NGO and INGO jobs in Nepal. So it's So it's a big challenge that the scope is limited in a few projects, and that there is a lack of governing body for professional social work practices. So there is a lack of mechanism, so to promote the social work practice scope. So and also lack of clarity in scope and working area. It's all because of the mechanism and coordination, I must say. And talking about geriatric care in Nepal, geriatric care traditionally until now in Nepal, it's an integral part of family role and responsibility. So but with the evolution of modern society, there is a shift in geriatric care in there is a slight shift in geriatric care in Nepal. And the geriatric so care has now started shifting into aged care homes and old age homes and aged care settings in Nepal. And relating the social workers role and in geriatric care, the biggest challenge in geriatric care is the unclear scope of social worker. Because I have already mentioned beginning that actually the social workers scope is mostly limited to few NGO jobs, and it's so because of that and lack of governing body. There is unclear scope of social worker in geriatric care. So another important issue is lack of awareness among social workers and geriatric care. It's very rare case that social workers are interested to work in geriatric care. Professional social work have very less interest in this geriatric care, and it's all because of lack of awareness, because they are unaware of the issue, unaware of this area, unaware of the scope, unlimited scope that it has in the geriatric care. And as I have already mentioned, that the lack of mechanism and coordination in social work practice in geriatric care. Geriatric care is itself a very hidden issue in Nepal, and social worker, so the professional social work being in its early stage and very unrecognized field. So there is a lack of mechanism and coordination. And mostly in aged care settings, people in general have this thought of hiring medical professionals and fulfilling the jobs of the jobs that a social worker could best perform also through some medical professionals. So basically also because of lack of funding and job opportunities in for professional social workers, maybe the social workers are unaware about the scope or scope. So because definitely it's our responsibility as well that we need to explore the scope of scope in geriatric care. The social workers, we ourselves should also explore the scope. So, and also because of lack of orientation for social worker to build their career through social entrepreneurship model in geriatric care, because it's a global issue that there is always the funding mechanism is like the issue, the aging issue is been in least priority. And in Nepal too, it's the same, either by the government body or by some private organizations. So, even though there are social workers who are interested to work, but they see the challenge of funding, they see the challenge of sustenance. So so I personally have experienced that the social workers should also be oriented to social entrepreneurship model. In a country like Nepal, though we are a very small country with a very small population, and but we have the scope of for scope for professional social workers, because as I mentioned in my previous slide, that slightly the geriatric care is been shifted to aged care settings, and there are very few organizations working for aged care services, very few organizations have started residential care services and dementia and Alzheimer care services in Nepal. So there is a lot more of scope, but the social worker have the professional social worker are unaware of this because when they think about the organization, the aged care services, they think that it's a business, it's a private model, and we are not our job is not focused in only in the private organization to just open the residential care services. So what I personally feel is that the social entrepreneurship model, that the social worker also can be a leader, and they can start residential care services, they can start Alzheimer and dementia care services, because there is a big gap in Nepal. There is people are unaware about Alzheimer's, dementia, and other related issue with senior citizens. And they even the general public now they have started to think the certain part of the population, but they do not get that services. So there is a scope for professional social workers that we can we can initiate our own aged care services platforms in Nepal. So but there is a lack of orientation so for social workers on these issue as well. So concluding points, I would like to mention that the strong body for coordinating social work practice mechanism in geriatric care is very necessary. So providing more exposures globally and locally for geriatric care with involvement of geriatric experts, orientation to social workers, and the unlimited scope of social work practice in geriatric care, and lobbying for their role for their crucial role. So, and also giving the strong emphasis on geriatric care specialization in MSW syllabus in university and colleges. That we have, though it's just started, that we have a geriatric care specialization, subject in mass MSW in Nepal, but this area is being of least interest for social workers themselves, and also the university colleges, the department are unaware to they are not giving much emphasis on the geriatric social work course, and while in terms of orientation to social workers, or in terms of providing geriatric experts exposure to social workers. So there is a big gap on this as well. So this is all I think what I'm presenting today. So it's like a summary, because in Nepal we are in very we are in a stage that the social work itself is an unrecognized field in Nepal, and geriatric itself, geriatric care is itself a hidden issue in society. So so I have just summarized some few learnings and notes from that I collected from sharing with my colleagues, and that I have learned throughout more than a decade being in the professional social work course and geriatric care field. So thank you so much for listening to me. Thank you so much.
Yeah, thank you, Dr. Rarati. Adopt a grandparent is a very, very innovative idea. I'm really impressed with that particular concept. But also the second one, which you spoke about, the scope of social entrepreneurship. There is a question related to this from Dr. Chandramouli from University of Mysore. He had asked you to throw a light on the scope of social entrepreneurship model in geriatric care.
Yeah, actually, as I mentioned earlier, that there is a big gap in aged care services in Nepal. So now the society is in need of aged care services like dementia care centers, and some residential care centers for us elderly who are not able to who are not being managed at home. So there is a big gap in society, and even we being a not-for-profit organization, we get so many calls regarding these services. So, the social entrepreneurship model in this geriatric field would be like, providing entrepreneurship opportunity for social workers. Like sometimes it may be, some seed grants opportunity for social workers to establish, to start for a startup, startup services. So basically, what I was willing to focus is, to bridge the gap that there's in a society regarding the aged care services. So the social entrepreneurship model would be in public-private partnership or private partnership as well, or it could be in form of, it could be in form of also from a not-for-profit organization. But there are few examples in Nepal that the aged care services are being started by few not-for-profit organizations. Basically, the model was that I was willing to mention.
Thank you, Ms.
Only
Arti.
before Dr. Lakshmi, before you close, only one comment on this entrepreneur model. Thanks, Arti, for talking a perspective on social work. Now, I think the government of India has come out with what is called an 100 crore allocation to promote what is called entrepreneurship among those who wanting to set up care for the elderly. I think they've announced it. I understand more than 600 applications have come, what is called startup. Now we have to see what is really going to happen, but the government of India has received those applications and we have to see how this is going to take place. That means the government of India is promoting, the startups for the elderly. So that could be a setup. And the second thing is, I think India also has a lot of private entrepreneurs have started setting up large size facilities for the elderly. So if you're talking about what really happens to social workers there, what Aarti is talking about, bringing the social workers as entrepreneurs, whereas the private enterprises need not be entrepreneurs, they need not be social workers. I think social worker skills, I don't think they are taught on entrepreneurship. I'm sure Dr. Lakshmi and Dr. Chandramouli and Dr. Popley, who are all in this group, can probably throw some light on it, because there is no entrepreneurship that you teach in social work. So unless you get onto those kind of private investment model, social workers' role, the dynamism or the leadership or ruthless decision making in private enterprises may not exist as a quality of a social worker. That's something that we need to bear in mind. Thank you for the, I'm sorry for the interruption.
Yeah, related to that, definitely there is a scope for social work trainees to learn about how they can start an organization and how they can manage and monitor an organization. But most of the social work trainees, they don't prefer to start their own organization. Maybe, again, it depends on the individual. But we do not give exclusive training on how to start an old age home as such, how to set up a care center as such. But basically, information is given how an organization can be set up, which is common for each and every type of organization which need to be set up or established. Okay, thank you. There is one more question from Professor Pushpinder Popley from Delhi. What should social worker do to empower elderly to take care of themselves in later years?
Okay, thank you so much. Actually, social worker have a very crucial role, for empowering elderly. So, what personally I have learned and experienced in my society is, social workers could create platform for elderly, because the platform is very necessary in countries like Nepal. It's just been a few years that now people have started setting up some social models platform where senior citizens could come gather, they could share their experiences, they could they could plan some projects to contribute to the society. So that makes, elderly, the senior citizens empowered. So that is what Sarnepal even started, with the daycare and lifelong learning center. It was a social model of daycare centers. So it was without any charges, but definitely it was. We conducted this program in coordination with the Ministry of Social Welfare, who directly looks after senior citizens. So even government conducted various programs in these platforms. So definitely this keeps elderly empowered. So the basic thing is, I think that's the platform for senior citizens that's missing, and that now we are trying to provide. Thank you.
Yes, again, related to starting up an organization is concerned. Again, Dr. Chandramouli has made a point that can we use CSR fund, Corporate Social Responsibility Fund, in order to start home care centers or old age homes. Maybe again, it depends on the concern of every company. Like if they have that concern for working for the empowerment of elderly, a particular company, then maybe definitely that also can be taken up. It depends on the company's purview of work, maybe. Yeah.
Dr. Lakshmi, before you close, I just want to know if there is
Yeah.
Mrs. Ghazala Menai, who was a former Joint Secretary to the Ministry of Social Justice. She is here. I'm not sure whether she's ready to answer this, an impression on what she really thinks. Particularly, she has been handling the aging department for a very long time, at least for 3 to 4 years of time. One of the very few, joint secretaries who handle this, issue. I'm wondering whether she would come in and then reply this, or I'm not sure whether she's ready, but I find her participating in it. Mrs. Ghazala, would you be able to come in, or we'll just close the session? Let's see whether by any chance she comes. If she's coming, just 30 minutes, 30 seconds, we'll wait.
Then she should be made as co-host.
Yeah, she has come. She has come now. She's just going to talk. I think, Prabhakar, can you just unmute her? Mrs. No, you have to unmute. Please unmute.
Unmute. They're not allowing.
Yeah, now you're coming. Now you're coming already.
Okay. Okay, now I'm sorry. I didn't, I was not, I don't know what question you asked.
The question is very clear. We are talking about the role of social workers in old age homes. And you have been part of the ministry which has supported social workers in a big way in all the running of old age homes funded by the government of India. So, by any chance, would you like to throw some lights on how we can move this the subject forward on the role of geriatric social work, not only from the NGO's point of view, also from the private. No,
I can share with you that recently, in fact, when I was listening to your the seminar today, I was thinking that I should actually write something about it. See, in this COVID, especially when I was hearing about the European countries and their handling of COVID, and I found that, my 87-year-old mother had COVID this time, and with my sister and my brother-in-law. And the problem we faced was basically of caregivers. Because, a COVID patient is, none of us can be, I was there for 3 days with her. Fortunately, I did not get COVID, but, it is a very scary situation. The whole house is infested with COVID and none of us can go in and help. So finally, when we found, we looked out and, this common friend, he provided me somebody for a week. And my mother was very bad because obviously at the age of 87, you don't know, and you've heard so much about COVID. You're very nervous and your body, you're not lifting. She was in ICU for 1 month. She came back. So then what our problem was that we did get some nursing staff, but somehow I found that in the COVID pandemic, the geriatric care was missing. Because there was so much pressure on everyone. Everybody was asking for nursing services because family members were not able to. If I had gone and helped her out, then maybe there was nobody to look after me if I got it. So that catch-22, we got many nurses, but the unfortunate part was that none of them were trained in geriatrics. But we had no choice. We were just, because this is a do or die situation, we just kept keeping anybody who came, who knew how to operate the oxygen cylinder, who knew how to give her oxygen in case of an emergency, who could take her, help her out in her daily, this thing. But that is what but there was a great, I realized that there is no, the social, we must have a benchmark for social workers, especially those who are working with geriatric. They should have a diploma. Like our National Institute of Social Defense conducts a 1-year course in geriatric care and geriatrics. Similar courses should be conducted, and we must insist now, because this COVID is not going, something else will come. So we must insist that our whatever, our nursing assistants, whoever we are keeping as caregivers, should be trained in geriatrics. I mean, that is one thing I personally feel. And in our NGOs, we do give allowances, and we do give money for caregivers, but that is for normal old people. Now, if a pandemic hits, then the kind of panic we saw in Europe and the kind of panic we saw in our own country, that should, I think, come down a little if we had a trained cadre. If there are people to look after them, because even in hospitals, the nurses were so badly, they were not there. So in one of my friend and her mother-in-law, we had to put one of this private nurse there, because there is nobody because everybody was falling sick. So we have to cater for this pandemic-like situation. Even otherwise, we have a huge this thing of senior citizens. So we must have caregivers, but geriatric caregivers have to be separate from the normal caregivers. And that is something I saw in this pandemic for 3 months in my own house. I realized that we must have people who know how to handle senior citizens, because they were rude. They were not so kind to her. My mother complains now when I go, she did this. I told her, you forget it, at least you are alive. You see, that was the kind of thing I had to tell her. But that was the truth, because they didn't know how to handle an old person, to be kind to her, to cajole her to eat, to give her medicines. So that kind of training, we need geriatric caregivers, because that kind of training only will help the senior citizens. Otherwise, senior citizens are at a loss. They don't know what to do, because you leave them with the caregiver. So I think that's all that I could think of, because I never expected Dr. Gangadharan to put me on the
spot.
On the spot. Thank you so much.
Actually, I want to actually put you this way. Yeah. There will be a real big spot. Thank you.
Thank you so much. Thank you all, because it was very nice listening to all of you.
I'm so sorry. I'm so sorry I took it by surprise.
No. It's my pleasure. Thank you.
Dr. Lakshmi. Yeah.
Yes, sir. Shall we?
We have exceeded the time. We should close. Yeah.
Okay then. So thank you all the speakers for the presentations. Whatever you have made, we have got an opportunity to learn a lot of things from each of the presenters, coming from different countries across the globe. And there are many things which had come to my mind by listening to the presenters, maybe which I'll share with Dr. Gangadharan later. So thank you all. Thank you, Gangadharan sir, for organizing this wonderful event on behalf of all the host universities. I thank you for today, and thank all the participants for being with us. It is a wonderful number of participants we can see here on the screen. Thank you all. Thank you very much.
Thank you. Now, let me say finally, thanks to all the speakers and Dr. Lakshmi for really earning it. Thanks, Dr. Chandramouli, for being active in participating in the last few days' time. And I must particularly say that, the communication that I've had with each of the speakers has been phenomenal. None of us picked up the telephone and spoke. It is all absolutely on emails. I think we have moved the technology so beautifully. And we sometimes think whether we will ever meet again for these kind of conferences in person. I think it's all going to be only this. I think we are learning a lot in the process. Thank you once again. And tomorrow we meet at 11 o'clock. We meet at 11 o'clock. Tomorrow is the last day that we meet at 11 o'clock. And that session, I'm sure Dr. Chandramouli is going to lead tomorrow. And with that, let me say thanks to all of you once again, participants. I think the feedback chat, I hope the feedback has already come in. Prabhakar, have you put it, I suppose? Yeah.
Yes, it's there in the chat.
Okay. Thanks, and please, it's there. Thank you once again. Any of you feel like communicating with us, do that. Dr. Lakshmi, once again, thank you. I think it is your inspiration of getting involved in these programs that made a lot of difference to me personally. Take care. Thanks.
Thank you, sir.
Thank you. Thank you. Thanks, Listen, thanks for coming, being with us yesterday and today.
Thank you, Ganga.
Thank you. Pleasure. Pleasure, Maggie. Thank you. Bye.
This is the feedback. Camera.